Good morning, Mr. Toby. Thanks for coming over within short notice.
Good morning, Dr. Sandra. Thanks for creating the time to see me. I really appreciate it, and I'm sure it will mean a lot to our viewers at home.
You are very much welcome. It's a good thing to have someone like you, who is committed and to educate people of the need to care for their health. With this, our job becomes a little easier, as many would have taken necessary caution as to what to do and what not to do with regarding their health.
Thank you, Dr. Sandra. Without wasting any of your time further, I would like for us to begin our session on what we have for our viewers at home today.
Of course, when you're ready, I am ready.
We would like you to shed more light on what breast cancer is, and relevant information that can be of advantage to our viewers.
Breast cancer is cancer that develops in breast cells. Typically, the cancer forms in either the lobules or the ducts of the breast. Lobules are the glands that produce milk, and ducts are the pathways that bring the milk from the glands to the nipple. Cancer can also occur in the fatty tissue, or the fibrous connective tissue within your breast.
What then are the signs and symptoms of breast cancer?
In its early stages, breast cancer may not cause any symptoms. In many cases, a tumor may be too small to be felt, but an abnormality can still be seen on a mammogram. If a tumor can be felt, the first sign is usually a new lump in the breast that was not there before. However, not all lumps are cancer.
Really?
Yes. Each type of breast cancer can cause a variety of symptoms. Many of these symptoms are similar, but some can be different. Symptoms for the most common breast cancers include a breast lump or tissue thickening that feels different than surrounding tissue and has developed recently, breast pain, red pitted skin over your entire breast, swelling in all or part of your breast, a nipple discharge other than breast milk, bloody discharge from your nipple, peeling, scaling, or flaking of skin on your nipple or breast, a sudden, unexplained change in the shape or size of your breast, inverted nipple, changes to the appearance of the skin on your breasts, a lump or swelling under your arm. If one has any of these symptoms, it doesn't necessarily mean you have breast cancer. For instance, pain in your breast or a breast lump can be caused by a benign cyst. But I'll advise, if you find a lump in your breast or have other symptoms, you should see your doctor for further examination and testing.
That's quite something. Thanks again for your time, Dr. Sandra.
Thank God, I'm happy that I am able to help. Kindly excuse me for about 3 minutes, while I quickly attend to the call from my pager.
We came fully prepared for instances like this. Don't worry, Dr. Sandra, we'll be waiting for you. While we wait for Dr. Sandra's return, can I quickly chip this in, that for those who have breast cancer, this is not the end of the world. We've heard of lots of successful treatments over the years. All you need to do is to ensure you take your medications and consultations seriously, while avoiding the things you ought to avoid. While we go on a quick break, please kindly subscribe to this channel by hitting the subscribe button below. And don't forget to hit the notification icon, so that you wouldn't miss our new videos in the future. We will be right back. Welcome back, guys, to today's episode of You and Your Health. In today's episode, it's quite a pleasure to have Dr. Sandra shed more light on what breast cancer is, their types, causes, and possible treatment. So, Dr. Sandra, can you briefly tell us some of what causes breast cancer?
After puberty, a woman's breast consists of fat, connective tissue, and thousands of lobules. These are tiny glands that produce milk for breastfeeding. Tiny tubes, or ducts, carry the milk toward the nipple. Cancer causes the cells to multiply uncontrollably. They do not die at the usual point in their life cycle. This excessive cell growth causes cancer because the tumor uses nutrients and energy and deprives the cells around it. Breast cancer usually starts in the inner lining of milk ducts, or the lobules that supply them with milk. From there, it can spread to other parts of the body.
Are there any risk factor?
The exact cause of breast cancer remains unclear, but some risk factors make it more likely. It is possible to prevent some of these risk factors. 1. Age. The risk of breast cancer increases with age. At 20 years, the chance of developing breast cancer in the next decade is 0.06%. By the age of 70 years, this figure goes up to 3.84%. 2. Genetics. Women who carry certain mutations in the BRCA1 and BRCA2 genes have a higher chance of developing breast cancer, ovarian cancer, or both. People inherit these genes from their parents. Mutations in the TP53 gene also have links to increased breast cancer risk. If a close relative has or has had breast cancer, a person's chance of developing breast cancer increases. Current guidelines recommend trusted source that people in the following groups seek genetic testing. 3. A history of breast cancer or breast lumps. Women who have previously had breast cancer are more likely to have it again than those who have no history of the disease. Having some types of non-cancerous breast lump increases the chance of developing cancer later on. Examples include atypical ductal hyperplasia or lobular carcinoma in situ. Individuals with a history of breast, ovarian, fallopian tube, or peritoneal cancer should ask their doctors or trusted source about genetic testing. 4. Dense breast tissue. Women with more dense breasts are more likely to receive a diagnosis of breast cancer. 5. Estrogen exposure and breastfeeding. Extended exposure to estrogen appears to increase the risk of breast cancer. This could be due to a person starting their periods earlier or entering menopause at a later than average age. Between these times, estrogen levels are higher. Breastfeeding, especially for over 1 year, appears to reduce the chance of developing breast cancer. This is possibly due to the drop in estrogen exposure that follows pregnancy and breastfeeding. 6. Body weight. Women who become overweight or develop obesity after menopause may also have a higher chance of developing breast cancer, possibly due to increased estrogen levels. High sugar intake may also be a factor. 7. Alcohol consumption. A higher rate of regular alcohol consumption appears to play a role in breast cancer development. According to the National Cancer Institute, NCI, studies have consistently found that women who consume alcohol have a higher risk of breast cancer than those who do not. Those who drink moderate to heavy levels of alcohol have a higher risk than light drinkers. 8. Radiation exposure. Undergoing radiation treatment for a different cancer may increase the risk of developing breast cancer later in life. 9. Hormone treatments. According to the NCI, studies have shown that oral contraceptives may slightly increase the risk of breast cancer. According to the ACS, studies have found that hormone replacement therapy, HRT, specifically estrogen-progesterone therapy, EPT, is related to an increased risk of breast cancer.
What about the types of breast cancer?
There are several different types of breast cancer, including ductal carcinoma. This begins in the milk duct and is the most common type. Lobular carcinoma. This starts in the lobules. Invasive breast cancer occurs when the cancer cells break out from inside the lobules or ducts and invade nearby tissue. This increases the chance of cancer spreading to other parts of the body. Non-invasive breast cancer develops when the cancer remains inside its place of origin and has not yet spread. However, these cells can sometimes progress to invasive breast cancer.
What about the diagnosis?
A doctor often diagnoses breast cancer as the result of routine screening or when a woman approaches her doctor after detecting symptoms. Several diagnostic tests and procedures help to confirm a diagnosis. 1. Breast exam. The doctor will check the breasts for lumps and other symptoms. During the examination, the person may need to sit or stand with their arms in different positions, such as above their head or by their sides. 2. Imaging tests. Several tests can help detect breast cancer. 3. Mammogram. This is a type of X-ray that doctors commonly use during an initial breast cancer screening. It produces images that can help a doctor detect any lumps or abnormalities. A doctor will usually follow any suspicious results with further testing. However, mammography sometimes shows a suspicious area that turns out not to be cancer. 4. Ultrasound. This scan uses sound waves to help a doctor differentiate between a solid mass and a fluid-filled cyst. 5. MRI. Magnetic resonance imaging (MRI) combines different images of the breast to help a doctor identify cancer or other abnormalities. A doctor may recommend an MRI as a follow-up to a mammogram or ultrasound. Doctors sometimes use them as a screening tool for those at higher risk of breast cancer. Here, learn more about how to prepare for a mammogram. 6. Biopsy. In a biopsy, the doctor extracts a sample of tissue and sends it for laboratory analysis. This shows whether the cells are cancerous. If they are, a biopsy indicates which type of cancer has developed, including whether or not the cancer is hormone sensitive. Diagnosis also involves staging the cancer to establish 1. The size of a tumor. 2. How far it has spread. 3. Whether it is invasive or non-invasive. Staging provides a picture of a person's chances of recovery and their ideal course of treatment. Another thing you need to know is that, having breast cancer, that is not the end of the world, as many people are used to believing. Should you notice the symptoms, ensure you visit the nearest hospital that is qualified to run the necessary tests on you, and abide by every instruction given to you.
Thanks for your time and patience in ensuring that you help clear out the fear and doubts of people over breast cancer. I am very sure our viewers at home would have gained one thing or the other from today's episode. We now have to go, so you can fully concentrate on your duties, as we can see that you are in high demand.
Thanks for the privilege, Mr. Toby. I'm glad to help. And it's a good job you are doing here. Please note that, should you need any other assistance, I'm here to help.
And we've come to the end of today's episode of You and Your Health. We had Dr. Sandra talk to us about what breast cancer is, its symptoms, risk factors and treatment. Please don't forget to subscribe to our channel, like our videos, and share to help educate and also entertain someone else. Thanks for watching, and bye-bye for now. We are viewers and lovely fans all over the world. We're welcoming you will be sharing some tips topic on depression, how to treat it and manage having too much family history. My name is Toby. See you next week. Bye.